Eric Hammer here, registered physiotherapist. Today I'd like to talk to you about the importance of reestablishing a correct gait pattern following a surgery or some other form of injury, whether in the lower extremity or in the back. But before I begin, please hit that subscribe button below. So essentially, when a patient has had an injury of some type, and typically in the lower extremity area, what can happen in a lot of cases is the patient will develop a difference in terms of their gait pattern, or they might start limping as a result of trying to avoid pain. Now you see this actually quite a bit in terms of, let's say somebody has a post-surgery of some type, or the patient might actually not be able, because of the surgery, to weight bear on a specific side for a period of time, right? So for example, if somebody's had, let's say, an ACL injury, or they've had some injury that requires a period of time, right, in which after the surgery, they can't fully weight bear. So this patient might be using crutches, or they might be using some other form of gait aid so that they don't fully weight bear on that one particular side. They might be feather weight bearing, or they might be able to kind of weight bear at 50%, but not able to fully weight bear. There'll be a period of time in which they have those restrictions, and then after that, the idea is to, again, weight bear as tolerated. Now, what I see with a lot of patients is during that period of time, if they've developed a specific gait pattern to avoid weight bearing on that side because of maybe some apprehension, or because it's still painful to weight bear, this can actually hurt a patient later on, even years later, due to different compensations that can occur because of this period of time of having their gait altered at all. And where I really see this is in terms of glute and pelvic stability and strength. So one muscle in particular is called the glute med muscle, glute medius, and essentially this muscle, what it's responsible for is for keeping the pelvis parallel. And what ends up happening is when we weight bear, when we put our full body weight on one side, its main job is to contract and keep that pelvis, again, parallel. So if a patient has had an extended period of time, right, where they're not weight bearing on that side, and they might have developed different gait abnormalities because of this avoidance, well, all of a sudden that particular muscle, or even some of the muscles that help to stabilize the pelvis, like the pelvic floor or the transverse abdominis, which are some of the deep core muscles in through the pelvis, well, they get weaker, right? So when we're not using these muscles, they actually become somewhat deconditioned. And then as a result of this weakness, the patient might start incorporating other muscles to compensate for this weakness when they're able to weight bear fully again. And now what can happen as a result of that is, because of these muscular imbalances and these compensations, the patient might then be prone to other injuries happening down the road. So for example, a really common one that I see is what's referred to as patellofemoral pain syndrome. So what this refers to is when the kneecap is not tracking well, is the term used, between the femur and the tibia. Now this tracking typically is a result of muscular imbalances. So in a lot of cases, this patient might be overusing their IT band, their quads, and then underutilizing the glutes. So in a lot of cases, these type of injuries or this type of pain can come about as a result of even years after this period of time where their gait was affected. And so really what we have to do with these patients is to have them relearn and develop, basically develop a new motor program for how to walk again, because they've gone through such a period of time in which they haven't been utilizing that glute med muscle, that now, because of these compensations, it's leading to other issues down the road. And so it's one of the things that especially when I'm dealing with somebody post-surgery and maybe there's some apprehension or there's some pain, that period of time in which they can fully weight bear again, it's super important to re-engage the proper muscles with walking, correct any sort of gait abnormalities so that it doesn't lead to other issues down the road. And again, this could be knee problems, this could be issues with regards to hip bursitis, lower back pain. So all sorts of different problems can occur as a result of this gait pattern being affected. If you have any specific questions or concerns, feel free to leave a comment below, and have a great day. Take care.